I think, my lords, that this issue exemplifies that the committee of this House is actually trying to do a white paper or consultation function. The problem that I have outlined and that Mr Rutkin outlined stems, I believe, from the different philosophy under each of these pieces of legislation. The Terminally Ill Adults Bill is all about personal autonomy, but the Mental Health Act is about treatment of illness, prevention of harm and preservation of life. This bill is the state enabling and enhancing autonomy to take your own life. But the Mental Health Act is the state taking away some of your autonomy in order to preserve your life and prevent you taking your life. So the guiding principle in the new Mental Health Act is, of course, one of the guiding principles is about enhancing choice and autonomy, precisely because the Mental Health Act powers take away some of an individual's autonomy, even when they still have capacity. So no wonder, if we've got different philosophical bases under two pieces of legislation, that there is not the crystal clarity that Mr Rutkin outlined to us for him and other clinicians. In practice, there is a human face, of course, also to this. Let's take, for instance, a young adult lives at home. They've been out of secure care for decades. They've always been treated well, their suicidal ideations managed, and they're well known to the local services. But they now have a terminal physical diagnosis, and they have a 6-month diagnosis. They've gone through the procedure in the bill, but they're now outliving that. But on the powers of admission for the mental illness, they're treated, and they've been treated on a number of occasions, and then no longer want to exercise their declaration. However, let's take, for instance, their family carers go on an extended extended holiday, and they go to stay with other family in a different part of the country. They get mentally ill, they're admitted, they have capacity under the Mental Capacity Act. So can the TIA bill be used in this situation on their declaration, or do they have to treat? Do the nominated persons have to be told? Because if you're exercising a TIA, you're no longer under the Mental Health Act. Could it be that the TIA is actually used without the family being told? Which we know is a scenario given by evidence from medical examiners. They come home and their relatives died. And no one knew that they'd just been accepted on a clinical trial at the local hospital.
Would accept the actual evidence of one member of the medical profession who gave evidence to the Royal Committee, to the Select Committee, who I think did reflect a lot of the concerns that people who support the bill do agree with, in which she said, and I quote her directly, "When the healthcare professions get it wrong, it's usually because we're being paternalistic." Now, I would say that a great many of the amendments which are produced this morning under this group, very well-intentioned, very well-meaning in terms of their concern for patients, do allow the fact that they rely on an assumption that the medical professions, in their doubts, may act paternalistically. Now, I've been married for a very long time to a doctor who would certainly say that the practice of medicine has changed hugely in his lifetime, and that when he first qualified and was a young doctor, they were paternalistic. But now there is